My name is Lisa Moore. I'm a nurse of 36 years. I am 59 years old. Um, I took the COVID vaccine, Moderna, in 2021. I took two shots and then I took the booster December 12th, 2021. And December 26th, I presented to the ER with lesions on my left lateral leg. It looked like a venous stasis type ulcer. It was very painful, nerve pain. But the doctors initially diagnosed me with cellulitis. We thought a spider had bitten me. I kept going to the ER, and I went in April of 2023, where they finally admitted me. I couldn't walk at that time. The lesions kept coming. I couldn't walk. What happens is my immune system is overwhelmed. When I have an infection, it fights the infection, but it also attacks me as well. It inflames my red blood cells and it causes sores and it attacks the biggest organ, which is my skin. So the goal now is to protect my inner organs. There is no cure for this condition. I can't even begin to tell you. I've been a nurse for 36 years and I've taken care of thousands of patients, but I've never seen a patient like me.
Lisa Moore began her nursing career at Bullock Memorial Hospital in 1989. She loved working with the elderly and made patients feel right at home.
If you miss me from singing down here and you can't find me nowhere, you just come on up to bright glory and I'll be waiting up there.
In 2017, I worked at this place called East Georgia Regional Medical Center. It's like 13 miles from my home. I was a nurse. I actually got hit by an 18-wheeler on the way to work, and that ended my career at the hospital. I had to have back surgery and I had to have shoulder surgery, and I resigned from the hospital in 2018. I went on a disability leave, medical leave, and the government declared me disabled from the accident, even though we went to court and they did not do me any justice. They didn't even give me enough money to pay my medical bills. So I was doing a project. I bake. I'm a nurse and I bake and I love elderly people. So I was working with a lot of elderly people. I was baking it forward and I was also taking them to the food banks and giving them rides to Statesboro, different things I was doing with the elderly. That was before the pandemic. So when the pandemic came, it was my own decision. I decided to take the vaccine because I was around a lot of elderly. It was a lot of panic, a lot of uncertainty. And I decided what they call now the jab. And the jab has done a job on me. It's affected me financially, mentally, spiritually, emotionally. I can't begin to tell you what it has done for my life. The jab was free, but it's cost me a lot.
It's actually, in layman terms, my immune system is attacking me.
With numerous health issues, she's easily susceptible to illnesses now. Recently, she's gone into heart failure, she's lost teeth, and had to rely on oxygen.
Dr. Ward told me there's no FDA-approved drugs because there's not enough people with it for them to even do studies on it. So everything's experimental, and I keep my wounds clean as possible. I'm not infectious. I just try to keep from getting infected.
Now Lisa's required to get labs done every month, sometimes every 2 weeks. The financial strain almost too much to bear. She thanks God for her strength along with a great family support system.
He won't put no more on you than you can bear, and I keep thinking of that. And I keep thinking of my mother, what she would say, keep on pushing, Lisa. Keep on fighting. Even at times when I felt low, I always came back up. I could hear the voice of Jesus saying, fight on.
After I was diagnosed with urticaria vasculitis, I knew something was wrong because 2 weeks later, I started having sores on my skin. And then I started doing some research about the mRNA vaccines, and I was fine until then. I didn't have any problems with my skin. But right now, I'm living a nightmare. I wouldn't even wish it on my worst enemy.
From here, Lisa's doctors say they're going to continue working towards a cure for her condition. And as someone who gave back to the community for decades, she says any monetary donations would help her medical journey tremendously.
They had me on Dapsone, which is they give for leprosy. And I end up in congestive heart failure. I ended up with respiratory failure, blood clots in my lung. I've had multiple infections, skin infections. I've had to go into the hospital and get vancomycin, Zosyn, and different things, which I'm worried about because the more you keep going into the hospital getting antibiotics, the more you build up a resistance to those. So I'm really worried about that. I have to use triamcinolone cream on my sores. It's a steroid type cream that I put on, and bacterial ointment. I use that to help. But as far as the pain and stuff, I take pain medicine, but it's burn. It's like nerve pain, just constant nerve pain, and you don't get any sleep because you're in constant pain from the burning. And there are days you can't even take a shower because of the burning. The pain is so bad. So it's really altered my life. My skin is marked up. My mind, they put me on steroids, and I don't do very well on steroids. They really make me anxious, easily agitated. But I have to have them to suppress my immune system. So right now they have me on Humira, also to help suppress my immune system, and Cellcip, which they give for patients that for kidney. They have kidney transplants, so their body won't reject the kidneys. So I'm on all kinds of experimental drugs, and a lot of them I've been allergic to. I've had very bad reactions to those. But these sores they're different than anything I've ever experienced in my life. It's really altered my life as far as going out, being around people. I can't infect anyone, but people can infect me. So I have to be very careful going into restaurants, different places, churches. Can't be around a lot of people. I do have to wear a mask. And sometimes that's not always a guarantee, because I went to the hospital. My dad was sick just recently, and I still got an infection. Nurse was coughing. I ended up with upper respiratory infection for 2 weeks. I've just gotten over that. I've had aspiration pneumonia. So the goal now is to save my inner organs, because once it gets there, I don't know how much time or what they can do. I could possibly end up on a kidney machine. I'm not sure. I don't know what tomorrow holds, but I know what holds tomorrow, and I'm just trusting in God. I'm like Job, though he slay me, I will trust him. It's really changed my life getting the jab. I always considered the vaccine, but it's like sometimes the doctors didn't really want to talk about it. I don't think they knew enough about my condition to even consider it until I went to Emory, and the doctor told me that I was allergic to the COVID vaccine. So they put me down as a allergic reaction. But I had already, in the meantime, reported my suspicions of VAERS and the vaccine injury line. And they've actually sent my chart to the CDC. And I am still waiting to hear from the CDC. And I've talked to a lot of other people. I've talked to a nurse. She got a different vaccine than I did. Her husband can't walk from it. A lot of people, they have the lesions, the sores, but they don't know that it's actually something more sinister, like urticaria vasculitis, because you have to have a biopsy to get this diagnosis. But I knew something wasn't right. It was 2 weeks after I got the booster that I came down with all these sores and all these problems, and the joint pain, the stiffness, the first thing, I was so weak and drained. I would be trying to clean up, and I'd be so tired. There was times I would actually fall asleep on the floor. My husband thought I was on some kind of medication that was making me do that. And I said, no, I'm not taking any. But it's very draining, and it makes you very weak and very tired. and I had to push myself. So when I'm on the steroids, of course, the steroids, they make me very hyper. I'm able to do things, but physically, my body won't let me. I want to do and I try to do. I have a little extra energy, but the steroids aren't good for me. And I talked to my doctor. I have a specialist in Augusta, Ian Ward. Um, he decided I have to be on the prednisone for the rest of my life because I've been on steroids for so long, for going on 3 years. He doesn't think my adrenal glands will wake up. So I have to take like 1 milligram for the rest of my life of prednisone. I'm taking Humira. The goal is now is just to suppress my immune system, to slow it down so it won't be so hyper, so it will stop attacking me. But I'm not the only one. There's so many different stories. They might not have urticaria vasculitis, but they have so much other stuff going on. I've met a man, he took the vaccine, he has bladder cancer. They took out half his bladder. But after I got the booster and started having all these problems, that's when I started talking about it. I wanted to share my story. I was actually looking for more people. I know there's more than just me in the United States. And then, like I said, I found other people in other countries that have it. It's really bad. It's a really bad disease to have. It's like I'm fighting a very unknown enemy. Even the doctors, when I go to the emergency room, they're like, you know, you're rare, right? You're one in, I'm like, yeah, so far I am. What do they usually do for you? I have to tell them what they usually do for me. They order labs, check the inflammation in my body, CRP test, SED rate, which is labs to check the inflammation, and white count, and give me antibiotics. But I have emailed Dr. Peter McCullough. He has responded back with Zoom video and inpatient visits. So, but he does know my diagnosis, and I have talked to him about it via email. But I know how much he charges. Like it's like $1,300-$1,400 just for a video conference. But then I have to fly where he is. One thing I can say, it took United Healthcare a long time, but they did start helping me pay for my Humira and the CellCept that I need for my body to live, because without it, I'd have more intense outbreaks. And I cannot think of his name, the Florida Surgeon General. I've also emailed him as well to get in touch with him. And I see Senator Johnson from Wisconsin is sounding the alarm on the vaccines. And I've tried to get in touch with Senator Robert F. Kennedy. I'm ready to go to Washington and tell my story. I have been in touch with React 19. I actually have a RN nurse. She's been wonderful, Lisa Anstead. She's been absolutely wonderful helping me get in touch with the programs, because not only does the side effects of the medication cause me to have internal problems, but it's also caused me to have problems with my tooth. My teeth have been falling out from the effects of the steroids and stuff. So I've been going through a lot. It's been a big burden, and she's helped me bear that. And I have several other friends. Like I have a sponsor, Jonathan McCullough, Urban Conservatives of America. He's been very supportive. Nate Noble. I have people that have reached out to me to help me. Recently, Angelica, she has a Pandemic Awakening site. She's been helping me trying to get my story out there, because actually we're looking for other people. Some Canada doctors reached out to me, and they sent me some V-medicinals. Thank goodness they've been treating me with the V-medicinals with a lot of herbs and stuff in them. So that's been helping, and I'm just thankful to everyone that has reached out to try to help me. Like I said, I've been a nurse for 36 years. I've taken care of thousands of patients, and becoming a patient has been very enlightening for me. You don't always get what you put out. And I learned that. And I am suffering from this disease. But I also know that every sickness is not unto death. And I just ask God to just ease the pain or heal me. vaccine compensation plan program. Um, but by the time you figure out that it's the vaccine, they just give you 1 year from the time you were diagnosed. So I took the vaccine booster December 2021. So the doctors had until December 2022 to diagnose me. They denied my claim of 40. They only paid $4,500 because it was too late. The time frame had ended. 1 year they give you. See, if I hadn't had a biopsy to begin with, when I first came down with the sores, they would have diagnosed me December 26th because that's when I started having the sores, the painful sores, and they have not stopped. Lisa Michelle Moore on Facebook, and I do have a COVID vaccine injury group. It's COVID vaccine injured. I actually had it public one time, but people were sending me different pictures of themselves, and I thought I didn't mind showing my body, my lesions, what was happening to me. But I was thinking of the other people that were sending me things that were happening to them, and I've made it private so I could keep them private as well. I have used other patients or websites to share to my group for information, even financially, the R19, some of their stories. I have a nurse friend, Liney Rich. She's she's a nurse that she's sick. She's on oxygen. It's just so many different stories. Um, but they reach out to me and I reach out to them and we're supporting each other emotionally because we're going through something we never thought we'd go through. And then we're not getting the help that we need. And, like I said, I spent nursing 36 years of my life. I'm still considered a CHS East Georgia Regional employee in Statesboro, Georgia. And my sponsors have reached out to them, even the media, and nothing. It's like I'm just been forgotten. And I spent 20 years there doing the best of my service. I love taking care of patients. I love interacting with people. I love networking. I love helping others. And I still do. I'm not going to let that deter me, what has happened to me. I'm trying to get to Washington. I'm trying to tell my story. And I want to take as many other stories with me. It's not, like I said, it's not just about me. It's about all the other ones that are really suffering. People laugh at us. Some mock us, but they can't stop us or block us. We're living the nightmares. We know what we're going through, and it's not in our heads. It's not in my mind. You've seen the craters, you've seen the sores. It's not artificial intelligence either. It's the real thing. I'm a real person sitting here talking to you, and it's not made up, and it's not in my mind. It's on my body, and it's in my body, and I need help. And I appeal to anyone that can help me and to help me get to Washington. I feel like I need to get to Washington.
There are thousands of people like you, and I've been doing this for 6 years now, where I talk to people like you, and I research the internet for people just like you, people who have been um, hurt,
Impact.
who have loved ones who have died, and they're seeking compensation, they're seeking treatment, they're seeking just support. And they form groups like React 19 is probably the best one I think I've seen.
Yes.
And I think that if you collaborate with other people that have not just your same condition, but have been injured by the vaccine, you can learn from them how they've been able to help themselves, how they've been able to fundraise money for, certain things that they need, like lawyer bills or to get treatment. I think social media is very powerful.
Yes, it is.
So
I agree.
um, I think if you want to get that help, you kind of have to put yourself out there, just like you did here today. And I really thank you for that.
I shared my story August 2024 with the WTOC News. Um, and the thing is, I still ended up with COVID after I got the vaccines and the booster. I still had COVID after that. Maybe a year later, I was diagnosed with COVID. But all I can do is pray and ask God to help me
Okay.
because I'm living this nightmare and I want to be awake. I want to be woken up from this. I don't know what anyone can do for me.
Well, I mean, we can support you. We can get your story out there. We can share with others. We can get like-minded people, people who have had the same experience as you, to help you make the proper decisions, whether it's for treatment, whether it's for trying to fundraise money, whether it's to try to contact uh, Senator Ron Johnson. Networking with people is going to help you. So I'm there to
I
help
think,
you. I'm going to post this interview onto my channel, and I'd love to have some type of link where I can send people to. So if somebody's interested to follow up with you about anything, they've got a place that they can go to see you and contact you.
okay, I'll send you my information. So, and I appreciate everything that you all are doing to help me.